Hello everyone, my name's Dr. Helen Hull and I'm the Programme Lead for Pharmacy and Pharmacology at the University of Portsmouth. I'll give people a little moment until we know that people have joined us, and if you have any questions, please feel free to ask. I'm going to give you a summary of the pharmacology course and the pharmacy course, and then I can answer some questions as well and hopefully help you with your decision of your degree programme. So we'll just wait a few moments to see if anyone joins us. I can see there's a few people already here, but I'll just wait a few moments. Okay, so I can see that there's a few people here already. So rather than sit here and say nothing, I'll talk about the pharmacology course, and then I'll talk about the pharmacy course. If you have any questions, I'll keep an eye on the chat as well and try and answer them as I go along. But if I don't, I apologise, and I can get to those at the end. So we'll start with pharmacology. So I've got some notes that I want to make sure that I cover everything. But if there's anything I miss out or I don't answer any questions that you were hoping to get answered, then do ask, please. So with pharmacology, the United Kingdom, and particularly at Portsmouth, we've been at the forefront of drug discovery and development for over a century, and was one of the first countries in the world to offer a bachelor's degree in pharmacology. At the University of Portsmouth, you'll be taught by globally renowned pharmacology researchers and educators, and they're very passionate about the development of treatments for diseases and ranging from Alzheimer's disease to cancer and emerging bacterial and viral infections. Pharmacology is an integral part of any medical degree or veterinary science degree or a life science degree. And at the University of Portsmouth, we deliver a comprehensive programme covering all the major aspects of pharmacology, such as medicinal chemistry, anatomy, biochemistry, physiology, pathology and therapeutics. In the first year of your programme, if you come to the University of Portsmouth, those are some of the topics that you will cover. And then in the latter years, you'll cover how drugs interact with the body, what we call pharmacodynamics, and what the body does to the drugs, which is pharmacokinetics. And that will help you to understand how drug treatments work. And in the final stages of the course, you'll look at new drug targets, perhaps of diseases that we currently are unable to treat. Now, the pharmacy degree programme at the University of Portsmouth, the pharmacology degree at the University of Portsmouth, it's accredited by the Royal Society of Biology, which what that means is we're accredited to give you a good learning experience. We are up to date with all the knowledge that you'll get, and we've got good support and teaching environments. You'll be able to take your knowledge of pharmacology and utilise this to develop a coherent drug discovery process that's applicable to all diseases that are prevalent in any country. And there are global differences that affect different diseases within different populations. And through your knowledge of this, you will be able to advise about the direction of travel required to best meet the needs of any country and its citizens. So global health, as we know now, we're in the middle of a pandemic, is of paramount importance for everyone. And pharmacology graduates will be ideally placed to help shape the future of global drug development. Many of our graduates from the University of Portsmouth work within a clinical research setting, and it helps them to run and support and coordinate drug development processes, and that can either be within the NHS or a pharmaceutical sector. Others can provide support in drug safety, regulatory affairs, as part of an approval process for new medicines, perhaps. Some of our graduates go on and do further study. They decide to do a master's degree or a PhD and specialise further, and then develop their research skills before they enter some academic research processes within university, within hospital, pharmaceutical industry. So our graduates from the University of Portsmouth that study pharmacology are equipped to work within either a clinical setting or a laboratory-based research setting, both in public and private sectors. And some people go on to be medical writers, or they decide to go into teaching themselves, whether that's in secondary setting or higher education. So someone's put here, what's the difference between pharmacy and pharmacology? Now, pharmacy, we embed pharmacology within pharmacy. So pharmacology, you learn all about the different medicines, work on the body, and how the body reacts with those medicines. So with pharmacy, the pharmacy program at Portsmouth, you will have the knowledge and the understanding and the chemistry behind the pharmacology of medicines. So we do very similar in year one of pharmacy and year one of pharmacology. Many of the modules are shared because the underlying knowledge of a pharmacist is very similar to that of a pharmacologist. So you'll do the same modules, shared modules, covering the chemistry and the biology and the pathology and diagnosis of disease. You'll learn about how medicines are formulated, so differences between solid dosage forms and liquid dosage forms, and both pharmacists and pharmacologists need to know that as well. But the difference between pharmacy and pharmacology is pharmacists are patient-facing, mostly either in a hospital setting or a community setting, a GP practice setting. So the difference here really is that you see what happens to those drugs and the patients that take those drugs. And that's the difference between the pharmacy and the pharmacology course. So pharmacy, we do an extra year at Portsmouth. All pharmacy degrees are 4 years, whereas pharmacology degrees are 3 years, because we have to embed that clinical knowledge and the patient-facing and the communication skills that you would develop as a pharmacist. So at the University of Portsmouth, we provide our students with individual learning opportunities that will be carrying out research projects and dissertations in your final year. But also we encourage you to make good use of your time outside of the classroom. We encourage you to work within pharmacy settings, whether it's in a hospital or a community. And you go on to placements, so you have an opportunity to see how pharmacists work in practice. Each MPharm is quality assured, so we're all accredited by the GPHC. It's a great place to study pharmacy at the University of Portsmouth. We've been accredited for the maximum number of years, 6 years, and we're due for accreditation in the next couple of years. So our accrediting body, the General Pharmaceutical Council, accredits all pharmacy degrees across the UK, and you can be assured wherever you study pharmacy, you will meet the standards required by the GPHC. It's very multicultural here at Portsmouth. We have lots of international students and students from different backgrounds, widening our participation for students, and everyone is given the same opportunity to thrive and to succeed. So wherever you come from within the UK or around the world, we can assure that you will be prepared and you will succeed in whatever it is that you want to undertake. Particularly within the pharmacy and the pharmacology course, students will undertake a diagnostic test. It's a bit like when you finish primary school and you start secondary school, you've done your SATs, they still retest you in year 7, don't they? They want to know the standard that you're at and what sets to put you in. We do a similar thing with our first years in pharmacology and pharmacy, and that will enable us to see how good you are at chemistry, how good you are at biology and the maths. And it doesn't matter if you don't do very well in it, but what that does do, it informs us on the support that we need to give you and enables you to see what I can remember from my college or A-level days and what it is I need to work on. So we really work hard with our tutors to enable students to succeed. So you identify those learning requirements and then we ensure that we help you and we enable you to develop. So that hopefully has answered the question that I've got about the main difference between pharmacy and pharmacology. Now, the biomedical sciences is slightly different. And what I would urge you to do with the biomedical science, because I'm not the program lead for biomedical science, I would encourage you to come on one of our virtual open days. On the 9th of January, we have a virtual open day that you can log into. And you can meet Gavin Knight. He's the program lead for biomedical science. So the person that's asked that question, to get the answers that you really need, I would urge you to go to the virtual open day, or just have a look at the website, because we've got quite an extensive knowledge of information on the website and videos where you can see Gavin and hopefully have your questions answered there. Do you have any advice for the pharmacy interview process? Well, the pharmacy interview process that we have here, obviously during COVID, it's quite different to what it would be if it was in person. Traditionally, what we would do, we would invite students or prospective students to come to the university, and you'd have like an assessment day where you would sit some interviews and some little values-based learning tests. We can't do that, obviously, for our next intake, so we're having online interviews. So it'd be a Zoom meeting, a bit similar to this, and you'd be asked some questions about chemistry, simple chemistry that you're undertaking currently at school or college, some questions about biology and maths, but more importantly, a situation judgment test. And what that is your values. And we'd give you a situation, usually around a patient, and we'd ask you, if you were the person involved in that situation, how would you deal with it? If you were the pharmacist in charge, for example. So it's all face-to-face, and it's online at the moment. And then hopefully when COVID is under control and we can invite students back, then obviously you'd come onto campus. So to enable you to see the facilities that we have at Portsmouth, we've created a multiple amount of videos to enable you to see the facilities that we have on offer. So I would urge, if you haven't looked already, just take a look at our website. But the interview process is quite straightforward, and at the moment, because of COVID, it would be online, but quite straightforward and easy for you to undertake. And in fact, we've got some on the 7th of January next year, where I'm interviewing students online, and we're going to be doing some biology and some chemistry and some maths, and then some questions around the role of the pharmacist and the values. So I'm glad that's been helpful. So thank you for your questions. Just trying to think of any other things that we could see. The other thing to perhaps remind you is that in order to be registered as a pharmacist in the UK, you have to fulfil the pharmacy degree, which is a 4-year programme. At Portsmouth, you do your 4 years all in one go. There's no gap year where you do your registration or your work experience. It's 4 years, then you go on to do the pre-reg. So following the 4 years following graduation, you would then have what we call a pre-registration year, or it's soon to be changed to be called a foundation programme. So by the time you guys come to do pharmacy, it will have changed to what we call a foundation programme. And that's a 52-week supervised year in clinical practice. So it could be in a hospital or in a community setting, or a combination of the two. Some people get an opportunity to do their programme within a GP surgery. And at the end of that, at the moment, students or graduates undertake the pre-registration professional exam. It's still uncertain how that would look perhaps in 5 years' time when you're going to be taking it, if you do pharmacy. And it could be competency-based by then, where you fulfil the programme by demonstrating, providing evidence that you are competent at a role. But it's uncertain at the moment how that's going to look until they've rolled out that programme. Currently, our graduates that leave Portsmouth and any school of pharmacy within the UK, they do 4 years, and then they do the pre-reg year, and at the end of that, there's a professional exam that they would sit. So it says, what is happening with COVID right now? Will I be taught in person next year? That's a really good question. It's really difficult, isn't it, to know what's going to happen with COVID. We've got a vaccine, and hopefully when everyone's vaccinated, the progression of the disease will slow and we can go back to normal. What we've done this year, so I can tell you what we've done currently and what we plan to do, but it's very difficult to predict how this disease is going to continue. But what we've done this year is we've provided what we call a blended and connected approach. So students have done some online activities. So lectures for certain have all been online, because there's over 100 students in each academic year, and so it's impossible to socially distance in a lecture theatre when there's over 100 students in that room. You'd need the size of a football pitch, wouldn't you, to self-isolate with that many people. So we made the brave decision right at the start that all lectures would be online for the safety of our students and obviously for our staff. The way we've done that is a combination of two things. We've either delivered the lectures live and they've been, half an hour to 50 minutes long. Or what a lot of us have done is we've pre-recorded small sections of lectures. So you have 10 or 15 minutes snapshots of different topics, and students are guided via our virtual learning environment to watch certain pre-recorded sessions before a Q&A session, a question and answer session. So you do the pre-watching of the topic before the live session, and then students join the lecturer in a Zoom room and we discuss what we've covered or what they've watched in the lecture. And quite often we create questions using, I don't know if you've heard of Turning Point. It's a bit like the Who Wants to Be a Millionaire audience participation pad. And using your phones, you can answer questions. So as a lecturer, I can see what you understand and what perhaps you're still getting wrong. And then I can explain the topic a little bit more clearly. So it informs me what students understand and what they need extra work on. So that's what we plan to do, continue to do, this blended and connected approach where lectures are online or pre-recorded. What we've also done, particularly in the first year, because we're conscious for first years, university is a really different environment. So our first years are in every week doing a workshop. It's not so much for the second, third and fourth years who have already experienced university, so they're perhaps in less often. But for first years in particular, we made the decision for pharmacy students and for the pharmacology students, they need to be in regularly. So we get to know you, we know what you look like, or we know what you look like from there up anyway, and you get to know us. So pharmacy in particular came in to do the dispensing workshops. So that's where you look at prescriptions, you analyse them for legality, for completeness, are they safe doses for the patient, and you'll spend some time in our dispensary dispensing those prescriptions. So to answer your question, what's happening with COVID and how will I be taught? Yes, you will be taught in person where it's safe and where possible, but where we cannot assure your safety in large lectures, then they are online. So that's how we plan to continue delivering our programmes within the School of Pharmacy and for Pharmacology, this blended and connected approach. Students also are assigned a personal tutor in year one, and you have the same tutor throughout the 3 years for pharmacology, the 4 years for pharmacy. And we timetable our tutorials on campus, because usually there's anything between 8 and 12 students assigned the same tutor, depending on the size of the year that we have. This year we have about an average of 10 first year tutees, first years to each tutor. So it's a small enough number to timetable safely on campus. So we book rooms that are large enough to enable you to socially distance. So at least you can come onto the campus, you can meet your tutor in person, they can get to know you, and you meet other people as well, and you tend to make some really good buddies in your tutor groups. It's a bit like school and college. You meet your tutor groups probably more often than some of the people that are in your classes, because you see them every morning at registration, or you certainly do it in school anyway. So hopefully that reassures you that it's not a distance learning programme. It's very practical, especially pharmacy. There's lots of things where you have to show us that you have a skill. So we need to enable you to demonstrate that skill. And the only way we can do that is have you on campus. So I've got here, how is the course assessed? Is it a mix of practical and theory? Yes, it is. It's assessed at the moment. We plan for this year for our written assessments to be online because it enables students to undertake their assessments safely. But we also have practical assessments. So in first year, for example, students will need to show us that they have the skill to undertake dispensing of prescriptions. So we've had these weekly workshops, and in January next year, the first years will have a practical assessment where they come into the dispensary and they have a series of prescriptions that they've never seen before, a bit like if you were working in a hospital pharmacy or a community pharmacy. And they would be asked then in a timed environment, it's usually an hour, and you get 6 prescriptions, one at a time, and they would dispense the prescription and write any advice that they would need to give, or if the prescription is not legal, they write the reason why they couldn't supply the medicine. Other practicals involve chemistry practicals, where there's, this year we get students to make paracetamol. They make a solid dosage form and then they test it. So they work out the purity. And in formulation, one of the practicals we get the students to do is they need to, it's right at the end of the first year, so you're bringing your science and your pharmacy practice right at the forefront of your knowledge. You've learned about the medication and you're learning about the patient. And we give you a patient, we tell you who the patient is, what their age is, what their symptoms are. So you make a diagnosis, and according to who that patient is, you decide what medication they need. And if, in effect, you have to decide, will I give them ibuprofen or will I give them paracetamol? It's a child, so then you need to decide on the dosage form. And from the age of the child, you then need to decide how many milligrams in 5 mils you would make the strength of the medication. So it's bringing all those skills that you have developed throughout the year at the forefront, right at the end of your degree first year. So there are assessments that can be practically assessed in addition to in a theoretical as well. So hopefully that answers your question. That yes, it's pharmacy in particular is very practical, and the other thing is your communication skills. So we give you an opportunity to work with each other, work with academics, work with expert patients to enable you to develop skills to counsel patients. I've talked a lot about pharmacy, but pharmacology as well is very practical, because to enable you to learn about how drugs work on the body, the pharmacokinetics and the pharmacodynamics, you need to undertake some practical work as well to help you to understand how those drugs work or medicines work that you're learning about. And more importantly as well, the project that you do at the end of the year in pharmacology, there's lots of laboratory opportunities, because what you'll do when you go off to work within pharmacology is probably going to be very practical orientated. So to give you the skills, those pipetting skills and the use of burettes and working within a laboratory, to specialise within a project, a research project, really enables you to develop those skills. One of the other things that I haven't mentioned is Erasmus. Now someone's here says, can I study abroad also? And will COVID, Brexit mean that we don't know? Those last 3 words are really important. We don't know. At the moment, we offer Erasmus opportunities, and what that is where students can abroad. You can take a year out with the pharmacology course, or you can work over the summer between your 2nd and 3rd year to undertake some research. So in your 3rd year, you write up your project from the Erasmus experience that you've had somewhere in Europe. And we offer the same for pharmacy students. Pharmacy students at the end of their 3rd year can also then go to another university in Europe, undertake some research projects within either a university or within a hospital setting. They come back for their final year, and the data they've collected for that year, for that Erasmus programme, they use to write up their project. Now, obviously, this year we haven't been able to do that because of COVID. The travel restrictions mean that we don't have those opportunities for students to undertake the Erasmus programme. So unfortunately, students last year, COVID obviously hit us sort of in March. So the students who planned to go to Europe to do their Erasmus programmes, right at the last minute. We had to cancel those. And this year we haven't been able to make arrangements because of the uncertainty associated with COVID. Now, in addition to that, obviously we've got Brexit, and I really don't know what's going to happen with the opportunities that we can offer with Erasmus. We plan and we hope and we strive to continue to enable you to undertake those opportunities, and we will work as hard as we can to make sure that those relationships continue. I would be very surprised if we would be unable to do so. It could be that this year might be a little bit difficult to arrange until all those uncertainties are ironed out and the travel restrictions are agreed and sorted. But I would be very surprised if those connections stopped, because it would have quite a detrimental effect on students' development, the relationships between universities across Europe. You only have to look at what we've achieved as institutions of higher education across the world working together, creating a vaccine for this pandemic. Now, if we don't have those relationships continuing, then it could have quite a detrimental effect. So whilst I'm saying I don't know, I'm very hopeful that we'll still have those opportunities. And if you're interested in pharmacology, it won't be until the end of your second year that these Erasmus programs would be available. And if you're interested in pharmacy, it would be the end of your third year. So by then, I am confident or extremely hopeful that all the governments will have aligned to enable us to continue with those research programs associated with the Erasmus opportunities. So I hope that helps. The questions have stopped coming in, so I'll talk a little bit more about pharmacy and the opportunities, because some of you were here when I said about the opportunities for pharmacology and working in drug safety and regulation and pharmacovigilance. But pharmacists, it's that next step, becoming experts in medicines and their use, and they work regularly, crossing over between careers in healthcare. So they can typically work in a hospital environment or a community environment. And the community, it could be in an independent pharmacy, you know, where you're just one pharmacist in one little pharmacy, independent pharmacy. Or it could be in a chain, a multiple, you know, like a large multiple on the high street. Or it could be within a doctor's surgery. One thing I can share with you is that from 2021, so degrees that you start, so this degree that you will start in September next year, the foundation program, the pre-reg program, the plan is for pharmacists on the day of qualification, they will also have an independent prescribing qualification. So part of your training within the degree will involve becoming a prescriber. So you can write prescriptions within a specialist area that you could focus on. And that qualification will start at undergraduate level. And then by the end of your foundation year, your fifth year, currently known as your pre-reg year, but it'll be called foundation year by the time you guys start, you will have that qualification of independent prescribing. And that's revolutionary. I think it's really exciting. And what's really good for us at Portsmouth is we already run a postgraduate certificate for pharmacists in independent prescribing. So for you guys, it's great. It's already embedded within your degree course, wherever you go within the country. But what we offer at Portsmouth is we've already got that programme up and running. So it'll enable us to include that within our undergraduate degree. But not only that, pharmacists, you know, my age and older, who've been on the register for many years now, we didn't have that opportunity. So there's lots and lots of practicing pharmacists out there already that have their degrees, but they're not independent prescribers. So when you finish, you're going to be better qualified than all those pharmacists. So what we're really proud of is that we can support those pharmacists and they can come to Portsmouth and undertake that postgraduate certificate as well. Within prescribing. So I'd be really keen, you know, to offer you that opportunity to come to Portsmouth because we've already got that independent prescribing embedded within our school. Okay, so I can't see any other questions coming in. One thing I would say is that both careers, whether it's pharmacy or pharmacology, it's a very rewarding career. You are experts in medicines, whether you're a pharmacist or a pharmacologist. But as a pharmacist, you also get to educate your patients. You get to help them to get the most out of their medicines. And you become part of the healthcare profession so that you make sure that everyone has the opportunity to take their medication safely and effectively. So I've got here, how are we supported on the course or during our placements? Well, I'm really proud to share that within pharmacy in particular, every student within every academic year has a placement opportunity. And as you progress through the 4 years, the placement becomes a little longer. The opportunity is longer in time, as it were. So in your first year, what we do is we have a relationship with our local large multiple, Boots Pharmacy within Portsmouth. We have a teacher practitioner, so it's a pharmacist who works for both the university and the large multiple, and she enables our students in first year to go into the pharmacy while it's still open, to undertake some activities within the pharmacy whilst people and shoppers are within the store. We arrange for their current pre-regs, so they're newly graduated pharmacy students, to look after you. So they're people that have been in your shoes 4 years ago, and you get little cases to do around the pharmacy. So you're not in a classroom, with books. You're on the shop floor, you're in the dispensary, you're behind the counter, and you're doing activities with the pre-regs. So it's starting you off to see the role of the pharmacist and what you would need to know by the time you graduate. And you spend all morning in the pharmacy. The biggest complaint I get is that my feet hurt. I've been on my feet for about 4 hours. So it's a good test as to whether you think you're up to it, because pharmacists spend a lot of time on their feet. And that's what you do during that session. So first year you get the opportunity to go into a community pharmacy, and that's the first term, so it's before Christmas. In the second year we have a couple of opportunities. We've got a relationship with a local independent pharmacy where you undertake some cases within the stores themselves, working with the pharmacists and the pre-regs, and you start to learn about controlled drugs, and you have little workbooks to work through within those activities. And we also give you an opportunity to visit one of our 4 trusts, the hospitals. So we have teacher practitioners that work from Winchester, Chichester, Southampton and Portsmouth Hospital. So we have 4 teacher practitioners. They work a couple of days a week for us and a couple of days a week at the local trust. And in your second year, you'll have the opportunity to spend half a day at the pharmacy based in one of those trusts. And again, you'll meet the pre-regs, the pharmacists on duty. You'll have an opportunity to go on the wards. A lot of them have got the robot within the pharmacy, so you can see how that works and how medications are selected. So you get a taster of what it's like within a hospital setting and within a community setting within the first 2 years of the degree. In the third year, we have a 40 credit module, so that's a third of the academic year, which focuses on both primary and secondary care. So in that module, we arrange for you a week in a community a community pharmacy local to the university. So it's all quality assured, and we've agreed with the pharmacist and the managers the opportunities that they need to enable you to fulfill. You have a little workbook to work through. So that really gets you used to that commitment of getting up every day, turning up for work, seeing what it's like to be a pharmacist within a community setting. So for a whole week or 5 days, you spend at that same community pharmacy. And then within the same term, in a different week, you then have an opportunity to go to one of the trusts and do the same sort of thing in a placement at one of the hospitals. So your third year, you get 2 weeks of placement, one in community, one in hospital. And I think that's really important to do it in year 3, because it's at the end of your third year, or middle towards the end of third year, you have to decide what you want to do for your pre-reg, for your foundation year. And the application process will start around about May in the third year. So our current third years, I know it's December, but coming back after Christmas, they're really going to have to start thinking about, where do I want to apply to do that foundation year? And we've got a very extensive support program where we support our students for interview, for preparation, to enable them to do some research into where they want to do their foundation year. So that's the third year placements. And then in the fourth year, there's 2 further placement opportunities. We've got a relationship with our local mental health hospital. So students have an opportunity to spend a whole day. They go either on their own or maximum of 2 students at a time to the local mental health hospital, and they learn to see how a mental health team supports those patients that require those extra support within the community setting or within that hospital setting. So it's quite a different environment, and it's probably an environment that not everyone would normally be exposed to. Some students are quite alarmed by the type of patient that they would come across in that situation, but it really prepares you to see that, you know, not all patients are straightforward. Some are very complex. Some have very complex medication regimes. So that's a lovely opportunity to push you perhaps a little bit out of your comfort zone, but still in a safe environment because it's within a placement setting. So that's one day, and that's within the hospital that's based in Portsmouth. And then you have an opportunity to spend a day in a GP surgery. So you work within the team, within the GP's practice, get to know the practice manager. In the third year and the fourth year, we teach you how to do some diagnostic tests. So you learn about how to take a blood pressure, you learn how to give injections, and a lot of our GPs, they ask our students, well, take that patient's blood pressure. I know you've covered it in your degree. Use it on this patient. We obviously get consent from the patient, but it gives you that sense of reality. You know, it's not quite the same testing it on each other, testing it on our simulated plastic arms in the lab. You're doing it for real with the patient, and that really prepares you for practice and your professionalism. And that's the point where students stop giggling and thinking things are funny. All of a sudden it's very serious and this is very real, and students enjoy that opportunity. So we have a lovely breadth of different opportunities for students. And I would encourage you also to arrange your own placements when you go back in the summer, whether you live in Portsmouth or you're travelling here to study and you're going back home. It's important to try and get that practical opportunity to study and work within an environment, because you've developed those transferable skills, communication, time management. No better place than working in the environment you want to work in. Having said that, if you've never worked in a pharmacy and you want to study pharmacy, it doesn't matter. Any job that provides a service to a customer will help to prepare you for the skills you need to be a pharmacist or a retail, whether it's, you know, McDonald's or any shop on the high street. You are dealing with different customers, different people, different moods, different complex people. Some can be very, very friendly, some can be quite conflicting, and dealing with conflicts can be a real challenge. So it doesn't matter if you've never worked in a pharmacy. If you've worked within a team of people, you've demonstrated those skills and you've delivered a service, if you've worked in a supermarket, excellent opportunity to deliver and develop those skills. So don't put yourself down and think, I'm never going to be able to do this because I've never worked in that environment. Any work experience is experience, and I would urge you all to try and get some sort of job experience, and that would prepare you. It's very, very obvious to us which students have worked and those that haven't, because of the skills they've developed. Okay, so I'm thinking here there's not many questions in, so I don't know whether this might be a good time to stop if there's no more questions coming in. I'll just wait a second. Any final questions? Okay, so what I'll do is I'll wrap up here. But if you think of any further questions, you can contact us directly using the website. I've got an email address that you can access using the Portsmouth website. But it's been lovely talking to you, sharing our courses that we've got within the school for pharmacy and pharmacology. And most of all, enjoy a restful break that you can have, I hope. And good luck with any exams that you're sitting prior to deciding to come to university. So thank you very much.